Okay, let's jump into a new deep dive. Today we're unpacking the latest issue of Medimagza.
Right, the magazine for the healthcare community,
Mm.
especially targeted at younger doctors, interns.
Exactly. And it's packed with insights, things like navigating tough careers, new health threats, practical medical info, too.
It's a good mix.
Think of this as your shortcut, maybe, to some key takeaways from medicine right now, based on these sources you shared.
Yeah, and what's really compelling, I think, is how it shows the reality for healthcare workers today. It's that blend, isn't it? The clinical side and the personal challenges.
It's not just about treating patients.
No, it's the whole landscape. It's demanding.
Absolutely. And it really focuses on young doctors' experiences.
Hmm.
There's a piece on the stress around internship placements.
Oh, that's huge.
It is. But the point it makes is more about perspective, you know? It's vital, sure, applying theory, but it's not the single thing that defines your entire career path. You find your way.
That perspective feels even more um, significant when you read something like Dr. Wyckoff's piece,
Yeah.
Beyond the Rhesus.
Oh, yeah, that was powerful. Rhesus being the emergency area, the resuscitation room.
He writes about the hidden emotional stuff in emergency medicine. Some really tough moments.
He does, the impact of seeing a 5-year-old after a shooting described as having blank eyes or telling a mother her child has died.
Yeah,
Just incredibly difficult.
it's hard. And he talks about saving the body, but wrestling with what might be lost inside, these invisible injuries.
Yeah, the ones no scan can show. It's that buildup, isn't it? The experiences don't just go away, they kind of settle, create this heavy box we carry.
And how do they cope? Often just by compartmentalizing, packing it away, as he puts it. Not always formal debriefing.
Right, just stark contrasts. And sometimes, he says, the only thing that pulls you back is a simple, genuine thank you.
A reminder that the work matters beyond just the clinical outcome.
And here's where it gets interesting, connecting that intense internal stuff to the idea from The Mountain Is You, which is also in the magazine.
The self-sabotage concept.
Yeah, that idea that we often undermine ourselves when our needs conflict, and that overcoming the big external challenges really needs deep internal work. You know, digging into past trauma, building resilience.
It really echoes that idea, doesn't it?
Yeah.
Facing the intensity of the ER, you're not just mastering the situation.
You're mastering yourself.
Exactly. Thriving isn't just about clinical skill, it's self-mastery, resilience.
Dr. Bobby Chabelli touches on that too, right? Advising young doctors dealing with complex careers.
Mm-hmm. Saying prevent burnout by accepting outcomes aren't always perfect.
Yeah.
And crucially, acknowledge the good you do achieve.
Okay, so shifting gears a bit. From the internal battles to external threats, the magazine flags some concerning clinical updates. Dr. Nutakozum Zamila, the bug doctor.
Yes, discussing diphtheria, its unwelcome return in South Africa.
It's striking, isn't it? A disease we thought was almost gone is surging. Makes you wonder about immunity gaps.
Definitely. It's caused by that bacterium. Corynebacterium diphtheria releases a toxin. Serious airway issues, but also potential heart damage, other organs.
And the recent NICD data is alarming, a 22% case fatality ratio.
Nearly a quarter of confirmed cases resulting in death. It's high.
And the real surprise, for me anyway, was the age group. 72% of recent cases are adults, 18 and over, median age around 26.
Precisely. It's not just a childhood disease anymore. That age shift is a major public health point.
Okay, what else? Another serious infection covered was infective endocarditis.
Right, an infection of the heart's inner lining often involves the valves. Dr. Incobil Manzini explains it.
So bacteria or fungi in the bloodstream stick to the heart valves, damage them.
Yeah, and they form these things called vegetations, basically clumps of infected material.
And those are dangerous because
Because bits can break off, they become septic emboline infected clots traveling in the bloodstream.
okay.
If they come from the right side of the heart, they can lodge in the lungs, cause severe infections there. But from the left side, well, they can go anywhere.
Like the brain.
Exactly. Leading to strokes or kidney failure, even gangrene if they block blood flow to limbs. It's very serious. Needs fast treatment.
Risk factors include prior heart problems, obviously, but it also mentioned a link to recreational IV drug use.
Yes, that's noted. And also, surprisingly maybe, poor dental hygiene, especially if someone already has a heart condition.
Wow. Shows how seemingly unrelated things connect, doesn't it?
It does. The magazine also covers practical things like confidentiality and data protection. POPIA, South Africa's privacy law.
Important stuff. Confidentiality is core, but the digital age complicates it.
The key takeaway seems to be about meaningful, informed consent for data. It's not just clicking a box online.
Patients need to truly get it right. What data, why it's collected, who sees it, how it's kept safe. It's all about trust.
Absolutely fundamental. And then, sprinkled throughout, are those reminders for personal well-being. Boost immunity, get flu shots,
Hygiene basics, recognizing illness early. Standard stuff, but always important.
and even a quick fitness fact squeezed in.
Oh yeah, the burpees. Doing about 20 burpees burns roughly 10 calories, depending on weight and how hard you go, obviously.
Just a tiny reminder of the body outside the hospital walls.
We've certainly covered a lot of ground here, from that invisible psychological weight on emergency staff.
And the idea that mastering your inner world is as key as mastering medicine.
Right, to the surprising return of things like diphtheria in adults and the dangers of septic emboli in endocarditis.
We touched on data privacy challenges too, the ethics around patient information.
And squeezed in that burpee fact. It paints a vivid picture, doesn't it? Medicine constantly demands not just clinical skill, but huge resilience, ethics, adaptability.
It really does. It's constantly evolving.
So it leaves you thinking, what does it really mean for all of us when healthcare requires mastering not just the medicine, but actually mastering ourselves?